In Manitoba today, another record-breaking number of COVID-19 cases. It's grim news for some hospitals that are already strained.
We get a call that a COVID positive is coming from the community. So they will drive up to the front of the hospital. They will phone us, and then they will come in, be triaged, and if they're stable enough, they will often go back and wait in their vehicle for hours before we have a bed to put them into.
Dr. Teresa Tam is concerned about the spike in hospital admission across the country. Her statement today, they are putting pressure on local health resources, forcing hospitals to make difficult decisions. Already in Saskatoon, officials say intensive care units are filled beyond capacity because of COVID-19 patients. ICUs have stopped accepting some patients.
Now is the time to get more people.
The Registered Nurses Association of Ontario says it's time for more boots on the ground in ICUs. Models released earlier this week showed Ontario hospitals could be overloaded within weeks. Grinspan says nurses are exhausted and struggling.
Now is the time to bring the resources, not wait a week or two.
In Quebec, COVID hospitalizations have remained fairly stable over the last few days. This physician and infectious disease specialist says hospitals aren't overrun, but the situation is fragile.
We're gradually losing our capacity to deal with if there were to be a sudden surge either from COVID-19 in a vulnerable population like a CHSLD, or we are, of course, entering the wintertime flu and cold season.
Outen says with that season approaching, many hospitals in the province could be dealing with flu patients and COVID-19, and that could be a deadly combination for hospitals across Canada. Valeria Cori-Manocchio, CBC News, Montreal.